Welcome to Graper Harper Cosmetic Surgery. I'm Dr. Harper. Today, I'm going to walk you through your consent form for tummy tuck, also known as abdominoplasty. If you have any questions while reviewing this form, please enter them in the portal below or feel free to ask them in person if you prefer. Let's start with what this procedure is meant to do. A tummy tuck is designed to remove excess skin and fatty tissue from the middle and lower abdomen and tighten the abdominal wall muscles. It can help create a flatter, firmer, and more supported abdominal contour. This surgery is not a treatment for being overweight, and it is usually best performed when your weight is stable. If you are still planning significant weight loss, it may be better to wait until that process is complete so your results can be more lasting and predictable. Now let me explain how the surgery is generally performed. On the day of surgery, you will be prepared and given anesthesia so you can be treated safely and comfortably. I make the planned incision, remove excess skin and fatty tissue, and tighten the abdominal muscles if needed to improve support and contour. In many cases, the belly button is repositioned so it sits naturally with the new shape of the abdomen. The exact approach can vary depending on your anatomy and goals, and in some cases, this surgery may be combined with liposuction or other body contouring procedures. Once everything is carefully shaped, the incisions are closed, and you begin the healing process. Every surgery has risks, so I want to go over the important ones clearly. Possible risks include bleeding, infection, delayed healing, scarring, swelling, fluid buildup, changes in skin sensation, contour irregularities, wound separation, and discomfort during recovery. Some patients may also experience firmness, fat necrosis, asymmetry, changes in the appearance of the belly button, or areas that may need additional treatment. More serious but less common risks can include blood clots, heart or lung complications, anesthesia-related problems, injury to deeper structures, persistent swelling, poor healing, and other unforeseeable complications that I cannot predict. Smoking, nicotine exposure, certain medications, and some medical conditions can increase these risks, so it is very important that we review your history carefully before surgery. Let's also talk about the benefits of surgery and the alternatives you may want to consider. The main benefit of this surgery is improvement in abdominal contour by removing loose skin, reducing fullness, and tightening the area for a smoother and firmer appearance. For some patients, that can also improve comfort and confidence in clothing and daily life. Alternatives may include choosing no treatment, focusing on diet and exercise for overall body fat reduction, or using liposuction alone if skin tone is good and the concern is more about localized fatty deposits. Each option has its own benefits and limitations, and the right choice depends on your anatomy, goals, and skin quality. Here is what your consent means. By signing this form, you are confirming that we have discussed the purpose of surgery, the expected benefits, the limitations, and the possible risks and complications. You understand that healing and results vary from person to person and that no surgery can guarantee a perfect outcome. You also understand that future changes such as aging, weight changes, or pregnancy can affect your long-term result. You agree to follow all pre-op and post-op instructions carefully, including guidance about nicotine, medications, activity restrictions, dressings, drains, and follow-up care. You also acknowledge that additional treatment or revision surgery may sometimes be needed, and that there may be financial responsibility for costs not covered by insurance. To summarize everything we discussed, this surgery is intended to improve the shape of the abdomen by removing excess skin and fatty tissue and tightening the abdominal wall when needed. It can create a flatter and firmer contour, but it is still a real surgical procedure with recovery requirements, limitations, and meaningful risks. It is important that you feel informed, comfortable, and clear about your decision before moving forward. You can now sign this form by scrolling down to the bottom. Please enter any required initials, dates, and signatures requested. You will be emailed a copy of this form as soon as you submit, and the office will receive a copy as well. Thank you, and we look forward to taking care of you.